Print, email, Facebook, Twitter. More. Queensland aged care standards often deplorable. Nurses Union says some elderly patients in Queensland aged care homes are only being showered once a week, while others have remained undiagnosed with broken hips or gone unmedicated because of a lack of staff, a union investigation has revealed. The Queensland Nurses Union made a surprise visit to 70 facilities across the state yesterday and described the situation in many homes as deplorable. State Secretary Beth Moll said the union surveyed workers in the facilities, who reported chronic levels of understaffing was leading to the mistreatment of vulnerable, older patients. It has become common practice in some facilities to wash residents just once a week, she said. Registered nurses have been left to look after up to 200 residents at a time. Our findings reveal unqualified staff are being allowed to administer dangerous and potentially life-threatening medications, that residents are falling and not being checked, that residents are laying with untreated injuries such as broken hips for days at a time and regularly experience malnutrition and dehydration. Ms. Mohel said aged care staff had also told them they had been asked to wash and reuse bandages, and that immobile residents were being left for up to 12 hours in bed without being turned. She said the federal government needed to regulate the industry to make it mandatory for a registered nurse to be rostered at all times. Ms. Mohel also called for the introduction of carer-to-patient ratios. Bundaberg nurse Rosaline Nichols worked in an aged care facility for 10 years and said the staffing levels made it impossible to completely care for all patients. The pressures are quite great, she said. The care that is required, which is physical, emotional, mental for the person, is not possible with the staffing levels. It's devastating, because what happens is we feel guilt, we feel levels of worry, we feel that we have failed the person, she said. Ms. Nichols said she feared patients' lives were being put at risk. Things could become very critical and people could pass away, she said. Federal Aged Care Minister Ken Wyatt said he had been in touch with the union and urged staff to report concerns to authorities. We've established an anonymous line with the Aged Care Complaints Commissioner to enable staff working in facilities to raise issues, he told Channel 9. Queensland has 454 residential aged care facilities and 13 of these have been given notices of non-compliance. Print, email, Facebook, Twitter. More.